Paw pads insulate and cushion vital bones and joints, and provide much needed traction. Because dogs are constantly on their feet, paws are susceptible to tears and other injuries. Dogs aren't very good at treating these wounds themselves, so some immediate first aid and TLC are necessary. We'll show you how to clean and bandage a paw pad wound. Support your dog's long-term recovery, and prevent and recognize further injuries. So, we are going to watch about the how to treat a dog's injured paw pad.
Method 1. Applying first aid.
First is examine your dog's paw if they limp, are licking it, or bleeding. If your dog suddenly is unwilling to put any weight on a particular foot, is excessively licking it, or tracking blood, odds are they have a paw pad injury. Gently take the paw and look between the toes, on top of the foot, and between the pads. Check for bleeding, cuts or abrasions, debris stuck in the pad, or an injured dew claw. Your dog may also have a ripped nail, which can cause a lot of bleeding. Approach your dog cautiously, since they may be prone to snapping if they're in pain. Be gentle and talk in a soothing voice. Step 2. See a vet if the wound is larger than 0.5 in, 1.3 centimeters. First aid at home is usually sufficient for a small, shallow, and uninfected wound. However, if the cut is deep, swollen, discolored, bleeds excessively, or oozes fluids other than blood, consult a vet. While many vets do not stitch small cuts, they may give your dog antibiotics to help fight a possible infection. Act quickly when you notice a potential problem. Paw injuries are susceptible to being contaminated by bacteria. Step 3. Rinse the wound in a bowl of warm, soapy water. Fill a bowl or bucket with lukewarm water and add 1 teaspoon, 4. 9 milliliters of antibacterial soap. Gently take your dog's paw and swish it around in the water for 1 to 2 minutes to clean the wound in. Rinse out any debris. If your dog is hesitant or resists, simply run the paw under lukewarm water instead. Targeting the wound as best you can. Also, remove any easily dislodged debris with tweezers. If the debris is deeply embedded, see a vet. Avoid the use of any antiseptics or antibiotics without vet approval. Step 4. Press a clean bandage to the wound to stop the bleeding. If your dog's paw continues to bleed after you have removed any debris and washed the wound, use a clean bandage or cloth to apply light pressure to the area until the bleeding stops. If you cannot control the bleeding after 5 minutes of continuous pressure, seek veterinary care. Have the dog lay down and elevate the injured paw to help slow the bleeding.
Step 5. Place an absorbent pad on the wound.
Position a sterile, non-stick dressing pad large enough to cover the entire wound over the injury. Or, use wound padding found in most first aid kits.
Finally, wrap the injured paw with a self-adhering bandage.
With light pressure, wrap the paw with a self-adhering bandage. Ideally one made for animals, such as wart wrap, pet flex, or pet wrap. Leave the front toes out, and wrap the paw up to the wrist joint. The claws of the paw should be nearly touching. Check that the wrapping is snug enough that it stays on their foot but loose enough that you can place 2 fingers under the bandaging. If the claws are separated or if the foot feels cold, you have tied the bandage too tight. Remove it and rewrap the paw. Tying the bandage too tight can cut off the blood supply to the paw and may even cause limb death. Call your vet if you are worried about tying the bandage too tightly. This will not only protect the injury from being infected, it will also offer additional cushioning for the foot pad.
Method 2. Ongoing care and recovery. First is change and rewrap the bandage daily.
Until your dog's paw is healed, replace the wound dressing each day, or more often if there is additional bleeding or seepage. Since dogs sweat from their paws, keep a close eye on the bandage to ensure it stays dry and clean. When you change the bandage, look for signs of infection like heat, swelling, foul odor discharge, or redness. Take your dog to the vet immediately if you notice any of these. Step 2. Stop your dog from licking or chewing the bandages with an A-collar. Dogs may try to lick or remove the gauze and bandage, and this will lengthen the time it takes for the wound to heal or even lead to infection. Fit your dog with a cone to prevent this until the wound has healed. A-collars come in a variety of designs. The most effective is often the traditional cone shape. Step 3. Cover the pad with a sock or dog boot when going outside. Even though your dog is injured, they will still need to go out for a walk or potty break occasionally. To further protect your dog's paw and to keep the recovery on track, temporarily place a sock over the bandage, or use a dog boot to cover the wound and bandages when going outside. Remove this covering when inside to let the wound breathe.
Finally, reassess the situation after a few days.
If, after 3 days of treatment, the wound continues to bleed or opens up, take your dog to a veterinarian for further treatment.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.